Hey everybody, happy Tuesday. I just wanted to do a quick Facebook Live about all of the illnesses going around that we've been seeing lately. The ER is seeing really record numbers of kids. We checked in over 80 yesterday from 7 a.m. to 3 p.m., which is pretty exhausting. And shout out to my team who's really just doing an amazing job trying to see patients safely and efficiently. Schools are just little petri dishes, right? And kids are sharing germs. And so I just wanted to give you guys some pointers on if your kids do get sick. I mean, mine, it's already hit our house. It's hit me and my mom pretty hard as well. Fever. So fever is not the end of the world. Fever is okay. Fever means your immune system is working and trying to get rid of whatever you have. So virus, bacterial infection, I will tell you most of the time it's a virus. Viruses, it's good and bad, right? It's good because they're not typically as serious as bacterial infections, but there is not a treatment that makes them better any faster. So it just takes time to let that run its course. Fever will fluctuate. It's going to go up, down, up, down. Remember that Tylenol and Motrin are fever reducers. They're not fever eliminators. So they're not going to stop you from having fever. They're just going to reduce the fever as long as the medication's in your system. And then as soon as it wears off, the temp is probably going to come back up. We used to think that the higher the temperature is, the worse the illness was, or the worse you were, the sicker you were, the more likely you were to have a seizure. And now we know that's not true. So a 101 temp and a 105 temp, believe it or not, are the same. Fever is fever. And I always tell people, I've had my kids have a 104 temp and be running around the house and have a 100.8 and be laying on the ground like it's the end of the world and they feel terrible. So my advice is always, Ladybug, helping out. Thanks, Ladybug. Not how they look when they have fever, but rather how do they look when the fever goes down. So when the fever's up, they're going to look terrible. They're going to feel terrible. They're going to look terrible. They're going to want to sleep. They're not going to want to drink. But when the fever goes down, are they perked up? Are they drinking? Do they have normal work of breathing? These are the things that are really, really important. Remember also that Tylenol and Motrin really will only get your temperature down 2 or 3 degrees. So if your child does hit a 105, then maybe they'll only get down to 102 with the Tylenol and Motrin. And then they might go back up to 103. And then maybe the next time you give the dose, they'll come down to a normal temperature. What we've been seeing, I mean, kids can have fevers for 5 to 7 days. A lot of it is the flu. We've seen mostly flu B, some flu A. We have seen other illnesses as well. So remember the flu test. Flu test is only for A and B. We're not testing for any of the other flu strains, and that's just the nature of the test. So 60, I think, I forgot the number, 50 or 60% of negative tests, those kids actually do have the flu. So it's got a high false negative rate. So a negative test doesn't mean you don't have the flu. A positive test is helpful and you do have the flu. So the treatment is really treating the fever and hydrate. Tamiflu is a medication that's available for influenza. It's not effective as it used to be in years past. And I'll be very honest with y'all, the side effect profile is, there's some pretty significant side effects associated with Tamiflu, including vomiting, headache, hallucinations, very bad rash. And we've also seen some kids having episodes of passing out. So we had the flu a couple of years ago, and I opted to not give the boys Tamiflu, and I didn't take Tamiflu. Please remember to get your flu shot, because the flu shot won't prevent you from getting the flu, but if you get the flu, your severity will be less. So when we had the flu a couple of years ago, 3 days of fever for us versus 5 to 7 days of fever. I'm going to keep doing these lives and might create a little group for kind of PDM/mom advice. Popsicles count as liquids, so kids all love that. If you find that your child won't drink, isn't going to the bathroom, and is having trouble breathing, make sure you're always looking up here. If they're sucking in, thanks, Ladybug, then they're having trouble breathing. If they're using their little bellies, they're having trouble breathing. If that persists after the fever goes down, then they definitely need to be evaluated. Let me know if y'all have any questions, and feel free to share. One more thing, if all of this advice applies to healthy kids who are immunized. If you have littles at home, less than a year old, you definitely need to call your pediatrician. And if they haven't received their 2-month immunizations yet, you absolutely need to call your pediatrician and maybe even just bring them straight to the ER. Oh, Archie's getting upset. Ladybug's getting upset. I guess this is the end. Thanks for watching.